Does childhood scoliosis resolve on its own? Scoliosis is a structural spinal condition that causes an unnatural sideways bend and a twist within the spine. Scoliosis is also a progressive condition, so it's virtually guaranteed to worsen at some point during the patient's life. Some cases of infantile scoliosis sometimes can resolve on their own, but it's impossible to know which ones will resolve and which ones will just continue to progress. So therefore, we look at scoliosis mostly to be a progressive condition. In most cases of childhood scoliosis, they're mostly diagnosed as something called idiopathic. Idiopathic scoliosis means there's no known cause. In fact, idiopathic scoliosis accounts for about 80% of all known cases of scoliosis, and it's definitely the most common type of diagnosis that we see in children. Although we don't know what causes scoliosis in childhood scoliosis, we do know that progression is triggered by growth, which is why childhood scoliosis always needs to be taken seriously no matter what age it's diagnosed at. Progression means that the condition itself is becoming more severe, and the size and the rotation of the scoliosis is increasing, and this will increase the condition's uneven forces throughout the spine and the body and can lead to more significant and severe effects. Progression is what makes scoliosis a much more complex condition to treat, because as the curve gets bigger, it's harder to manage and to reduce. So therefore, as a progressive condition, the treatment is more about managing how this curve is expressing itself and to really manage the ongoing nature of scoliosis to try to reduce the curve as best as we possibly can and prevent more severe effects from occurring. Proactive treatment works towards preventing progression, rather than traditional treatment, which is more focused on responding to once progression has already occurred. And once curves have already worsened, like I mentioned, they're much more difficult to treat. Now, when we look at the different types of scoliosis, one of the types is something called congenital scoliosis. And congenital scoliosis is when patients are actually born with scoliosis because in utero, something in the spine develops abnormally. They have an abnormal shaped vertebra, and at birth, they're actually diagnosed with scoliosis. And this is one type of something that we call infantile scoliosis because they're diagnosed at a very young age. Patients that are diagnosed between 3 years and 10 years of age can be diagnosed with something called juvenile scoliosis. Now, the younger a patient is diagnosed with, whether it's infantile or juvenile, the more likely the curve will worsen because they have more time to grow and develop. Now, the most common type of scoliosis that patients associate scoliosis with is something called adolescent idiopathic scoliosis. And this is the most prevalent diagnosis that typically affects children between 10 and 18 years of age. And the reason why this is the most common type is because this is when scoliosis patients go through rapid growth. And so therefore, rapid growth is by far the biggest thing that's associated with rapid progression, because as patients grow, the curve has a chance of growing with them. Now, female adolescent scoliosis is definitely the most common type of diagnosis. We know scoliosis is more common in females than males. It's a 4-to-1 ratio. And the reason why we think females progress are more likely to progress than males is because they go through a shorter growth spurt. An average female will go through a 2 to 3 year growth spurt, where males tend to go through about a 5-year. And they also go through a growth spurt at an earlier stage in life. Females will go through growth spurts somewhere between 11 and 13, where boys tend to go through growth spurts somewhere between 13 and 15. So because of the early onset of growth and the shortened, more rapid nature of growth spurts in females, this is why we think we see scoliosis more common in females. Now, when we focus adolescent scoliosis treatment, the best thing to focus on is to try to reduce the scoliosis and manage the scoliosis during this constant trigger of growth that occurs until a patient is fully mature. When we look at childhood scoliosis, when we look at how we want to treat it, there is really never a guarantee, but we do know the earlier you find scoliosis and you combine that with early intervention, we know there's much fewer limits that can be achieved with that person. Again, the only type of scoliosis that would ever resolve on its own, it's only one type, and those are infantile cases that are diagnosed before 2 years of age, and for some of these patients, as they grow, it goes away. That's the only time we see like spontaneous resolution of a case. And again, it's not all of them, it's just a few, and we can't tell you which ones. Any person outside of that range, we never see just spontaneous resolution. Normally we're going to see is continued progression. We just can't tell you how much or how long, but we do know that growth is what makes it happen. Now, like I mentioned, traditional treatment tends to respond and wait till curves get bigger. And as these curves get bigger, they start start recommending more invasive types of treatments. And eventually they get recommended something like invasive spinal surgery or fusion. And this is normally the dominant choice when it comes to traditional treatment options, is they wait for the curve to become big enough to start considering surgical fusion. However, before the invention of the pedicle screw and the Harrington rod, conservative treatment was the main treatment for patients that had scoliosis. And the idea was to try to manage the scoliosis and not let it become severe. That has kind of died off because now most patients are being recommended surgery because of the invention of these surgical techniques. However, that holds a lot of risk and potentially a lot of long-term effects. So now, as a result of that, conservative treatment is now coming back into the fold where people are seeking more proactive and more corrective types of approaches for dealing with scoliosis. And this is typically a combination of scoliosis-specific types of chiropractic care, typical types of adjusting that could be moving the spine or adjusting the spine, most tilted vertebra into a better alignment. It can also be combined with types of physical therapies and scoliosis-specific exercises that are applied to increase spinal flexibility, making it more responsive to other types of treatments, improving the muscle tone around the spine, improving balance to help improve the way the spine is supported. And lastly, we also look at scoliosis bracing. This has also become more effective as time has progressed and has become more and more adaptive in dealing with scoliosis patients. And now corrective bracing can definitely be effective on patients that are growing. But as a result of the new designs with bracing, we can also use these with young adults and patients that are fully mature. So when we look at scoliosis, we do know that growth by far is the number one trigger that causes progression. So therefore, since children are diagnosed with scoliosis, we can expect them to continue to grow and develop. We have to be concerned about progression. And progression is more likely than not progression. The degree of progression is unpredictable, but we normally would expect it. So the danger of just simply waiting for scoliosis to go away or hoping that you're one of these cases that don't progress can leave you in a very careful situation, because if the curve worsens, it becomes more significant and harder to treat, making it more difficult to get the results that you want. So our recommendation is to always, the minute you find scoliosis, is to seek treatment in reducing the size of curve, because a smaller curve is always better. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.